So we are one of the largest programs in the country, in the world actually, and so we're one of the five top programs in the world now. So and we do about 500 transplants a year here. So the interesting thing about stem cell transplants versus bone marrow transplants is that the stem cells are the same coming from the bone marrow or the blood, but the blood has different kinds of cells in it than the bone marrow. So there's some benefits and some negatives of using blood versus bone marrow. If you have aggressive blood cancer, then it's probably better to use the blood than the bone marrow because there are more active immune cells in the blood than in the bone marrow. So for patients that don't have malignancies like aplastic anemia, which is just bone marrow failure, we try to use bone marrow so that there's not as many immune cells that we infuse into the patient so the patient doesn't develop this untoward toxicity called graft versus host disease.
The body's less likely to reject those cells.
Yeah, and the rejection is also an issue. But the more important thing is the cells that go into the patient have less immune cells coming from the bone marrow, so there's less of this graft versus host disease. And you don't want that if you don't have a malignancy. And so there are slight benefits and detractors for each kind of stem cell source. But the stem cells are the same whether they come from the bone marrow or the blood.